Case 11. A 40-year-old woman in Miami consults a plastic surgeon for abdominal liposuction. After the surgeon fully explains the procedure and its possible complications, the woman agrees to have the operation and is scheduled for surgery the following week. Approximately 3 weeks after the liposuction, the woman's abdominal skin becomes dimpled in the area where the surgery was performed. Extremely upset with the outcome, she threatens to file a malpractice suit against the plastic surgeon if he does not repair it. The picture here is obviously not dimpling, this is scarring. I just found this on the internet. What is a malpractice suit and what criteria justify it? A malpractice suit is a civil suit under negligence that requires 4 fundamental criteria, also referred to as the 4 Ds. They are duty, dereliction, damage, and direct. First, it must be understood that the physician had a duty or responsibility to the patient. Second, the physician must have breached that duty, which is called dereliction. Third, the patient must suffer harm or damage. Finally, the harm caused must be a direct cause of the dereliction. In this case, if the physician decides not to perform a reparative procedure, are the grounds for malpractice justified? It depends. Although the duty and damage are present in this case, it is unclear whether the physician was derelict in his duty and whether the patient's abdomen dimple is the result of dereliction. For example, if the patient did not follow post-operative instructions, even though she was told to do so to prevent complications, the physician's actions would not be the cause of the harm. But if the surgeon did not follow the standard of care in her treatment and this caused her complication, the woman would be justified in suing. What is the difference between a criminal suit and a malpractice suit regarding the burden of proof? In a criminal suit, the burden of proof must be beyond a reasonable doubt. In a malpractice suit, the burden of proof is more along the lines of lack of reasonable and ordinary care or skill on the part of the physician. What is the most common reason for litigation between a patient and a physician? The number one factor leading to litigation is poor communication between the physician and the patient. What action should the physician in this case take? The physician should try to find the reason for the dimpling. If it is determined that he made an error in surgery, he should immediately apologize to the patient. Studies show that if a physician is honest and upfront about an error, he or she is less likely to be sued by the patient. Lastly, if miscommunication was the culprit, the physician should make every effort to prevent such miscommunication in the future.